Hello and welcome to another informative and educative episode of the Meet the Practitioners on HealthAfrik. This program is brought to you by the Association of African Universities, a collaborative effort between the Center for Pregnancy and Childbirth Education and the AAU. My name is Isabella Tete Ahinakwa. Today we'll be discussing the essential care for every stage of motherhood. We understand how scared you are, especially with regards to early mothers, and how nervous you are to go through the 9-month journey. Today we have all the information for you, as well as the guidance to go through the journey. Stick with us as we go for a quick break. When we come back, I'll introduce our guest to you and then start with the discussion. Stay tuned. You're welcome back from the break. This is Meet the Practitioners on HealthAfrik. If you just joined, you can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube. And today, as mentioned earlier, we'll be discussing the essential care for every stage of motherhood. Joining us here live is Dr. Hansen Gashon, who is an obstetrician gynecologist from Kwelebu Teaching Hospital here in Accra, Ghana. Hello, Doc.
Hello.
You're welcome to Meet the Practitioners.
Thank you.
Great. Before we begin, I would like you to tell us more about yourself, although I've introduced you to our viewers.
Okay, so my name is Dr. Seth Hansen Gashon, and I'm an obstetrician gynecologist working with Kwelebu Teaching Hospital at the moment.
Okay. Welcome.
Thank you.
Great. So today, as mentioned, we will be discussing essential care for every stage of motherhood. And when we talk about motherhood, most of the terms we mostly hear is prenatal, antenatal, and postnatal. I would like you to tell us or give us a differentiation between these terms.
Okay. So thank you very much, and a good day to your esteemed listeners.
Okay.
So when we talk about antenatal care and prenatal can be interchangeable.
Okay.
It's the medical care that a pregnant woman receives prior to delivery is antenatal or prenatal care. And then also we have intrapartum care. That is the care that the pregnant woman receives during the labor process and then delivery. And then we have the postnatal care, which is the kind of the medical care that the pregnant woman receives immediately after delivery and up until 6 weeks.
6 weeks
Following delivery.
Okay. Mostly when I go to the hospital at the OPD, I do hear the midwife saying, when you are pregnant, you should come for checkup. You should always be coming to the hospital. Even if you feel feverish or anything, come to the hospital. Someone will ask, why early and regular prenatal care, and how crucial is it to maternal health?
Okay. So it's important to come to the hospital for the antenatal care and to report early and regular. This is because, first of all, when you are pregnant or once you do a pregnancy test either at home or in a hospital and it confirms that you are pregnant, it is important that we identify whether the pregnancy is intrauterine or extrauterine. Extrauterine pregnancy means ectopic. So a scan will be done which will confirm that the pregnancy is intrauterine and that pregnancy can then continue. If you don't go to the hospital, the first time you may appear there will be when maybe you have a ruptured ectopic, which can be deadly. So it's important that once you realize you are pregnant, you go to the hospital, you have a scan done. Then also, it's also important that once you do the scan, we'll be able to tell whether the pregnancy is viable or not.
Okay.
Because there are times when the pregnancy, you may be pregnant, but the pregnancy may not be viable. Okay. Then also, it's important to go to the hospital early because when we, so that we can be able to date the pregnancy. When we date the pregnancy, usually in the first trimester, the date is more accurate than when you report in the second or third trimester, and the scan is done to date the pregnancy.
When you say date, you mean the prediction for delivery, right?
Yes,
it's accurate.
prediction for delivery.
Okay. And you made mention of intrauterine, extrauterine, and also viable. Does it mean that whether the pregnancy is viable, does it mean that if it is extrauterine, it is not viable? You can't continue with the pregnancy?
Yes, so if the pregnancy is extrauterine, it can lead to a number of complications. Okay. Even though we have seen a few pregnancies being carried to term, abdominal pregnancy, where the baby has been carried to term, most of them, especially the tubal one, because that space was not created to carry a pregnancy, can rupture. Okay. Okay, and then once it ruptures, the woman will bleed into the abdomen, and that can cause shock or even death. Okay, and even with the extrauterine ones, the abdominal pregnancies, it can also have a lot of complications for the woman.
Okay. Being an obstetrician gynecologist, I know you've encountered a whole lot of comments and also misconceptions about prenatal or antenatal care. Can you share with us some of these misconceptions and also clarify with the facts?
Okay. So some of the myths and misconceptions about antenatal care include sometimes some believe that antenatal care or starting antenatal care early is for first-timers. Okay. So if I've been pregnant 3 times, there's no need going. Maybe when I'm getting close to time of delivery, then I'll report to the hospital. But it is very wrong. As I have said, there are, aside the things I talked about, there are signs of disease which can occur if we are able to identify it early. For instance, hypertension, diabetes, we can be able to manage it and then prevent the complications. So if you don't report early, maybe by the time you will report to the hospital, you may report with a complication. There are times when we've had women reporting for the first time with a seizure. Somebody who is probably about 30 weeks or 35 weeks presenting with a seizure. If this woman has presented earlier, we may have picked up the signs and then prevented some of these complications.
Yeah. Thank you. And then, okay, yes. Are there any other misconceptions?
Yes. So there are a number of other misconceptions. So some women also believe that once you are healthy, it's not necessary to go for antenatal, or at least regularly. Okay. So even though the doctor scheduled me to attend antenatal today I'm feeling okay, so there's no need to go. It can be a problem because, as I mentioned, there can be complications which may be subtle. Initially, most of the complications that can occur in pregnancy, most of them starts asymptomatic, does not show any symptoms. So if you don't go to the hospital for assessment to be done, we will never know that there is a problem. Then also, even with the baby too, we also need to know how the baby is growing. There are investigations that sometimes we may do to check the well-being of the baby. If we don't know, if you don't report to the hospital regularly, we may miss some of these things. So.
Thank you. So if I should come to you as an early mother with maybe, the period of 6 weeks, or I'm pregnant and I come to you for prenatal care or antenatal care, what are some of the essential tests? You made mention it is important, and the screening you do for these mothers.
Okay. So the essential tests that we do include blood tests, and blood tests such as a full blood count, where we check the hemoglobin level, that's the red blood cell, the levels. So then also we also do we check for something called G6PD. Okay, some of the drugs that we give during pregnancy, we need to check so that it can prevent complication of sometimes the red blood cells can break down in certain situations. So we need to know the woman's status. Then we also check the woman's blood group. So especially for women who are negative blood, sometimes there are some interventions that we need to put in place for them. So we check the blood group. Then also we check for infections that may occur, which we can identify in the blood. For instance, syphilis, hepatitis B, HIV, and all that. We check them. And then also we do tests related to sugars. So we want to check the fasting blood sugar, whether there's any problem with any of these. Then also we do investigations. There's something we call toxoplasmosis. It can affect the baby, and then rubella. They are things that can affect the baby. So we do tests for them. We also do urine tests. And urine tests, we check for urine proteins, we check for urine glucose, we check for infections, which sometimes may not be able to have signs yet. We call them asymptomatic bacteria, which can lead to complications in the woman. And usually with the urine proteins, we check every visit that the woman goes to the hospital. We check the urine protein and then the urine glucose. So it's essential. Then also we do scans. So the scans we do, as I mentioned, we have the early scans, which checks for dating, viability of the pregnancy and where the pregnancy is located. Then also we do an anomaly scan, which is usually done around 18 to 22 weeks. This scan helps us to know whether the baby that is formed is okay, where there are no abnormalities. Sometimes some of the abnormalities may not be compatible with life, whilst others may be compatible with life. And but interventions will need to be made, or preparations will need to be made for delivery of these babies. Then also there are other additional tests that can be done for high-risk patients. So if you have somebody who is advanced in age or has had abnormal baby before. They are, so we call them prenatal screening. There's a quad test that can be done to check the risk of having an abnormal baby. Sometimes too, there are interventions like amniocentesis or chorionic villus sampling, which can help us to know what whether the baby has any abnormalities.
Okay. You just mentioned sometimes, if you can break it down for us.
Oh, okay. So with amniocentesis, what we do is that we use a needle to take some of the fluid, the amniotic fluid, and then it is studied. There's baby cells can be seen in it, and then it is studied to check if the baby has any abnormalities. And with the chorionic villus sampling, what we do is that we take a part of the placenta and then send it to the lab for studies.
Thank you.
But this is not done for everybody.
Everybody, yes.
It's done for just a small fraction of women who are high risk.
Right. Thanks for clarifying that. We all know, or well, I would say that when it comes to pregnancy, women go through a lot. You would say, because you're an expert, you say it's an interesting journey. But someone sitting there will say, this doctor, he doesn't know what I am going through, the discomfort and the experience. People are going through, and I know for sure that they really may not know how to manage these discomforts. So if you can share with us, maybe someone is planning to get pregnant the next week. So what is the person expecting, some of the discomfort, and how can the person manage? I know they vomit, early morning sickness, and a whole lot. Share with us.
Okay, so it's true, sometimes pregnancy, there may be some discomforts during the pregnancy, but I must say that the pregnancy journey is different for everybody. There are people who may experience something and others may not experience, and even the severity of the experience may also be different. You rightly mentioned morning sickness, which is the women, they tend to vomit very early in the mornings. So sometimes when they wake up or when they are brushing their teeth, they may vomit. Usually 1 or 2 in the morning, that's what occurs. And this can affect about 70% of women. There are times when it can be more complicated, where we call it hyperemesis gravidarum, where the woman has persistent vomiting throughout the day, even in the night, and it's a number of times during the day, till the point where the woman becomes dehydrated. But for morning sickness, usually what we advise the woman to do is that it's important that you don't take too much water. If you have to take food or something, you take it in portions so that the nausea, you don't end up vomiting.
Yeah.
You avoid spicy and oily foods. Sometimes dry foods are better. Ginger sometimes helps. So maybe you have ginger biscuits or even ginger that you can put in water and drink or something. It also helps with the morning sickness. Also, another discomfort that women experience is that sometimes they can have headaches. These headaches can be mild during pregnancy, but when the headache is persistent and continuous, then it's important that you report to the hospital. Then also, they can also have heartburns. So this is something that occurs a lot. A lot of women complain, and it worsens as the pregnancy progresses. This is because as the uterus enlarges, it pushes the abdomen and reduces the volume. Then also some of the pregnancy hormones tends to lower, relax the sphincter. That's the end of the esophagus. So usually when you, after eating, it should shut. But in pregnancy, sometimes it may not shut completely, and the acid in the stomach may come into the esophagus or the gullet, and this can cause a lot of irritation. So we advise that women should, after eating, they shouldn't lie down immediately. They should sit down for at least 2 hours before lying down. And even when they lie down, they should raise the head end of the bed or using pillows. So that, they will not be so flat. And then also, they should also not eat large quantities at a go. So they can take it in portions, and they should avoid very spicy foods and oily foods.
Thank you. We'll go for a quick break. When we come back, you continue sharing the signs and symptoms of these complications. Please stick with us. We'll go for a quick break. Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action. All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Africa.
In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika.
Tune in every Monday from 8 a.m. to 10 o'clock GMT. Join us to make it a fantastic day together.
Hello Africa, your daily connection to the continent.
Explore a whole new world of exciting visuals with AAU TV. Get ready for a mix of interesting talk shows, interviews, discovery documentaries, and news on AAU TV. It's not just about watching TV, it's about experiencing something special. AAU TV reaches over 25 countries in Africa, bringing you a blend of knowledge and fun. Learn about different cultures as you enjoy the shows. If you have events or want to showcase your business, we've got you covered. Watch AAU TV free-to-air channel on satellite. Connect with us on Facebook, Instagram, and X, formerly known as Twitter, at AAU TV. Reach out on call or WhatsApp us at +233 26 629 6601 or +233 20 399 5210. AAU TV, the voice of higher education in Africa.
You're welcome back from the break. This is Meet the Practitioners on HealthAfrik, and if you just joined, today we are discussing the essential care for every stage of motherhood. We are joined here by Dr. Hanson Gashon from the Kolebu Teaching Hospital. Before we went for break, he was sharing with us some of the common discomforts pregnant women are going to experience and how they can manage it. Doc, thank you for sticking with us. Let's continue with the discomfort, but this time, let's look at there are stages: first trimester, second trimester, then the third trimester. So let's look at some of the potential complications. What are the signs and symptoms as a pregnant woman? If I should see this, I know, okay, it's leading to this complication, then I need to go to the hospital.
Okay. All right. So during pregnancy, there are some signs and symptoms that a woman may experience, which may signal that there's a problem. As I mentioned earlier, most of the conditions that, like hypertension, diabetes, infections, and all that, most of them are asymptomatic. So I will advise that women go to hospital regularly. They don't wait for the symptoms before they go, because sometimes the disease may be there before the symptoms may even appear. Things that pregnant women should look out for. One of them is lower abdominal pain, severe lower abdominal pain. So if you are experiencing severe lower abdominal pain, it could signal that you may be having a threatened miscarriage. It could also, patients with fibroids can also have severe lower abdominal pain. Okay. And then also when sometimes there is an infection, you can also have severe lower abdominal pain. An abruption, sometimes the placenta can separate from the uterus, and this can, when it starts, it can cause a lot of pain. Then also sometimes pregnant women may notice that they are losing water. So this shouldn't happen until labor, or around the time of labor. So if you notice that you are losing water, and when you lose the water, what happens is that there will be a gush. So you see water in your undies, and then it may splash down along your thighs. Once you notice something like this, or maybe you are asleep and you realize that the bed is wet, you need to rush to the hospital so that, you can be managed. There are times that we see women who have had this symptom but have remained home 3 days, 1 week before reporting, and you can have an infection. You can lose your baby. It can also affect you negatively. And then also bleeding. So once you become pregnant as a woman, the monthly bleeding that you were experiencing and all that, now bleeding is over. Okay. You shouldn't bleed. Okay. Any amount of blood that you see, whether it is spotting or not, it's important that you visit the hospital. It could mean that you are having a threatened miscarriage, or you are losing the pregnancy. It could also mean that you have a placenta abruption, it could, which I have explained earlier, or you can have placenta previa, where the placenta is low-lying. Okay. Then also, it's important to also, from somewhere around 18 to 20 weeks for first-timers, and then 16 to 18 weeks for people who have given birth before. They start feeling fetal movements or kicks. After some time, you get used to the number of kicks that you are getting, or how frequent the kicks are. If you notice that the kicks has reduced, it means that you have to report to the hospital. It may mean that the baby is not doing too well. Okay. Then also, sometimes there may be symptoms of, for women who may have hypertension or are now developing hypertension and developing the complication. They can have severe headaches. So if you notice severe headaches, pain, epigastric pain, that's pain just below the chest, vomiting. Sometimes they may also have blurred vision, or when they are looking at something, they may see flashes of light, or some area of the vision may be dark. We call it scotomas. So when you notice any of these things, or all of a sudden you notice that your legs are getting swollen, or your whole body, your face is getting swollen, it could signal a complication of hypertension, which we call preeclampsia. If interventions are not put in place, you can fit. So it's important that when you notice these things, you go to the hospital. Sometimes too, pregnant women may urinate a lot. Under normal circumstances, there's what we call frequency. So when you are pregnant, you may have frequency because of the size of the uterus and then where the uterus is close to the bladder, so it can reduce the bladder volume. So you may urinate at short intervals. But sometimes the volumes of the urine may be a lot. And then you may also be drinking a lot. And then you notice that now you are eating a lot. It could be signs of diabetes. So it's important that you report to the hospital. Sometimes too, you may have fever, you may have pain on urination. You shouldn't have pain whilst you are urinating. If you notice, we call it dysuria. When you notice any of this, it could be a sign of urinary tract infection, for which reason you have to report to the hospital. Some may also have vaginal discharge and all that, which are all signs that...
I know there are more. From the way you are talking, I know there are more complications with, and that stress on the importance of regular checkup. Now, you made mention of bleeding and also the swollen feet.
Yes.
I know I've heard that you can be pregnant and still be bleeding or be menstruating. And then also I do hear that if you have a swollen feet, it means that the baby is a boy. That is why you're having that symptoms. Probably you can clarify this for us.
Okay. So with the swollen feet, having the swollen feet does not mean that you are going to have a boy. Or sometimes pregnant women can have mildly swollen feet, which is normal. Okay. And this is because the veins that drain fluid from the legs or blood from the legs, the uterus together with the baby and the fluid sits on those vessels. So the flow of this fluid from the legs reduces. So when pregnant women stand for a long time or sit for a long time, they may experience this. So we usually advise that they lie down, or when they are and when they lie down, they raise their legs, or when they are sitting down, they raise their legs. But when it becomes very severe, together with high BPs, it could signal a problem. That is preeclampsia. So it doesn't necessarily mean that you are going to have a boy. Then also for the bleeding, if you are pregnant, you shouldn't bleed. There are times when somebody may bleed and we may check and the pregnancy may still be intact. But bleeding during pregnancy is when it's early pregnant, we can call it threatened miscarriage. If it continues, you can end up losing the pregnancy. So once you notice that you are bleeding, don't think that, oh, I am the type who, when I'm pregnant, I bleed. Or when I'm pregnant, I still have my menses. It's important you visit the hospital, a scan will be done, doctor will investigate you and then identify what is causing it, and then appropriate treatment can be given.
Thank you. Let's come to childbirth. How should the woman be physically and emotionally prepared, and also with lifestyle? What are some of the guidance or measures we have to take to be fully prepared for childbirth or labor?
Okay, so antenatal care is one of the areas that we use to prepare women for childbirth. Because during antenatal care, you have one-on-one encounter with your midwife or your gynecologist who allay your fears. But the problem is that some women, when they come and sit in front of the doctor or the midwife, they will not say anything. They will be very quiet, everything okay. It's only when they move out that they complain. But the doctor is there, or the midwife is there because of you. So any challenges that you have, you need to let the doctor or the midwife know about it. Then the person can be able to help you. Then also sometimes we do antenatal classes where we educate the woman on what to expect during the labor, the pregnancy, the labor process, and then following delivery. And sometimes we even schedule visits to the hospital, the labor ward, so that the woman can have a look at where she will be laboring or where she will deliver. And all that. If she has any questions, she can ask. All this sometimes allay the fears. Then also, but as I mentioned, some of the women do not see this antenatal classes as important. So they may come for antenatal care, but when there is time for classes, they will not come. So it's important that every woman takes the antenatal classes very seriously. Sometimes because of time, the doctor may not be able to have enough time to talk about all this. But when we put the pregnant women together, we are able to give them the necessary training and advice. And then somebody may ask a question which may be relevant to you, but you may not have asked that question. So it will be of benefit to you. Then also during the antenatal process, there's also exercises that the woman can do, which we sometimes, for some hospitals, we have people who come around to take them through some of these exercises or train them on what to do. Some of these exercises include stretching exercises, brisk walking, and all that, all these things. And then we also have what we call Kegel exercises, where the woman will try and when you are going to urinate, and then maybe you are in a place where you can't urinate because for any reason, you try to hold the urine. So they try to hold and then release, hold and then release. It's Kegel exercise, and this helps to strengthen the pelvic floor muscles, which can help during the delivery process.
Okay. Now, this goes to the family. I know how pregnant women struggle just to convince their partner to join them during the antenatal care. Please advise our partners the importance of their involvement within this period.
Okay, thank you very much. It's always nice when you are in the consulting room and a man walks with the wife into the consulting room. And it's good because sometimes the man tends to ask questions which the woman may not have asked. Sometimes when I'm in the consulting room and I'm talking to my client and I ask, and the client says that, oh, there's no problem. Then I ask the husband, is there any problem? Then the husband will tell me a whole list of things that the woman has been complaining at home, but got to the hospital and is quiet about it. So, I mean, we can see that, I mean, the man's contribution is significant. The man also provides emotional support to the woman. So, during the pregnancy, there's a lot of hormonal changes. Sometimes the woman can be high, sometimes she can be low, sometimes she can be sad, and all that. But it's good that there's this support that is always there. There are times when the woman will come to hospital and then maybe there's a diagnosis that has been made that, oh, maybe there's a problem with the baby, or you have developed hypertension, you have diabetes. This can make the woman very, they can go down when this happens. But if there's a loving partner around, he will be able to provide that emotional support. There are times when the woman also needs physical help. So, I mean, she needs somebody to help her with something and all that. Because once she's pregnant, there are things that she will not be able to do. And when the man is there, the man can help. It also helps when the man is around, the man can be able to bond with the baby. Right intrauterine. Most of the time, the women have the advantage because they are carrying the baby. But we, the men, do not have that advantage. But coming to antenatal care, going for scan with your wife, will help you to start bonding with the baby early. Now you are seeing the baby in the uterus, the baby moving. You are hearing the baby's heartbeat and all that. So by the time the baby is born, you already started bonding with the baby. And this continues even after delivery, and it strengthens the family union.
Right. Now, to wrap up, share with us some of how can a parent balance parenthood and also their own well-being. I know after childbirth, they go through a whole lot, taking care of the baby, taking care of yourself, and even the family. So how can they balance parenthood and also their well-being?
Okay, thank you very much. So it's important to balance parenthood and then your own well-being as a woman. There are times when once the woman gives birth, everything is about the baby. Everything is about the baby. But you need to be strong yourself to be able to take care of the baby. So you need to prioritize your health also. So your diet, the exercises that you are doing, your medications. Once you are doing that, then you yourself, you can be strong. I mean, even doing exercises and all that. And then also, you should also delegate some of the things that you need to do as a newborn mother. Your husband can help you, your sister, your cousin, your in-laws, your mother, and all that. This is the time to bring everybody around. This is not the time to repel people. So once they are around, sometimes they can help you by carrying the baby. There are times when the baby may not sleep in the night, so you may not have been able to have enough sleep. So now you may have to, somebody can help you with the baby, and then you can have some sleep. So all these things are important. Then also, it's important to also manage your emotional health. There are times when once the woman is pregnant, she may go even to the mother's house and she'll be there forever. But it's important that, I mean, you look at your relationship with your partner too. It's very important. You don't gain by losing. So you have to balance so that you make time for your partner also. Because, I mean, your relationship with your partner also helps you to relieve some of the anxiety and the stress that may come on with childbearing. There are times when people give birth and then they have this pregnancy blues and depression and all that. So these are complications that can happen in the puerperium. But if you look at your emotional health, your relationship with people and all that, sometimes it can help to a large extent.
Thank you very much, Dr. Hansen Gashon. I know I can see a man smiling because you've made mention or you've talked the person's mind. Thank you very much for joining us and also sharing this important information with us. And we hope to meet you again on Meet the Practitioners.
Okay, thank you very much.
This brings us to the end of today's episode, where we discuss the essential care for every stage of motherhood with Dr. Hansen Gashon from Kolebu Teaching Hospital. Please, let's take the advice from this episode. If you are experiencing any sign, do not do self-medication. And to our fathers, our husbands and brothers, please support your wife, your sister going through, that motherhood period. Thank you for joining us, and see you again in our next episode. Bye.